This is amazing here. I've got Landon Scott and his mom Sarah is in here with me. So Landon, can you tell me your age?
15, about to turn 16.
Okay, so 15 and 3/4 or like actually?
Like 16 tomorrow.
Happy birthday, brother.
Appreciate it.
Awesome. So Landon, you came to us and you had a major problem, right, Sarah? Like we had problems for a long time. What was going on?
Just pain that we had been misdiagnosed, I guess. He was years ago diagnosed with Hodgkin's lottery.
Mm-hmm. So he came to us with knee pain, right? With the right knee.
Yes.
Okay.
That we had been told, there'd be pain but no problem. There became problems. And then I go, torn meniscus, physical therapy for half a year.
Yeah.
No activity. Then he came home one day, like, there's like a tearing, ripping pain.
Okay.
Okay, we're dealing with something else. So this at that point it had been about a year and a half.
Okay, and he was like 14 years old when this is going on, right? Avid soccer player. Landon, what was that like for you? Is it like gut? Like, tell me your feelings.
I mean, like, I'll be like, going in the middle of a game. It's like I could hardly move my knee without just feeling like I would like tear it off. It was awful.
Yeah.
And then, like, after football this year, like, I couldn't walk on it after games and stuff.
How long could you not walk after a game?
The game, whenever, like, we decided to come here, I couldn't walk the entire next day.
So literally, pain so bad in his knee. He's a 15-year-old kid. Pain so bad in his knee, can't walk. And then, couldn't do anything, right? You're
basically, yeah.
Avid athlete. What are your sports?
I do football, soccer, and track.
And so all year round, you're playing something.
Yeah, and it's a constant knee pain. It was like unbearable at some points.
Yeah. And so what triggered you guys to want to come and talk to me here at Pinnacle?
That game when I couldn't walk for like a whole day after, we knew we had to get it. It was something bad and needed to get it fixed. So
This was in football season, so this was last year,
Yes,
about
sir.
6 months ago, right?
Mm-hmm.
Yes.
Cool.
August, September-ish, I think.
And he had severe knee pain, came in to see me. I couldn't even touch his knee. I'm mashing on it right now. This guy would jump off the table. And he's not a cusser, but he would have cussed. And so you actually had seen another orthopedic surgeon here in town.
Correct.
Yes.
Awesome guy.
Yes.
Really, and did the right thing for you. So how did you guys end up over here at Pinnacle Integrative Orthopedics?
It's when he came home that night from the game and couldn't go to school the next day. I called, that doctor, and he said, okay, we need to go next step. And that's when he mentioned the PRP, but that's when he referred us to you.
Yeah.
And he's like, hey, this guy's the expert in this field, so let's try this route.
And so when we met, we looked at his knee. We just had the perfect way to help him.
Yes.
Just the perfect way. So, the goal is to use your body's ability to heal itself to do that. You're a healthy dude. And so just worked so well. What kind of concern, we elected to do some PRP on his knee. Mm-hmm. We looked at it with ultrasound. We did a lot of evaluation here in the office. What sort of concerns did you guys have before the procedure?
The only concern I had was, I guess, the pain of it. I mean, I did everything, and I knew it would all be good. Of course, with the other videos we've seen. And
Right.
I wasn't too worried about that, except obviously any kind of discomfort.
Mm-hmm.
For me, at that point, it was kind of a last resort before surgery, which I want to avoid that because it changes your body forever.
Totally.
It doesn't matter. Right?
Especially for this problem.
Exactly. And at this age, to be that young. So really my concern was just the time and in the end, like maybe the mental, emotional effect of not being able to participate. Like that was probably my biggest concern.
Right. Watching your baby suffer.
Yes.
And then coming to really have an intervention and do something about it. Mm-hmm. You get that feeling of, oh my gosh, what if this doesn't work? What if he's going to suffer forever? Right. That's always my concern when I'm looking at my kids.
Yeah.
What was the procedure like for you?
I mean, just you walked in, they drew your blood, and a couple, 10 minutes later, they came in, just numbed it up a little bit, and did the injection. I mean, your heart really feel it.
Right.
And all that worry about the pain, there was just nothing really.
That's great. So the super tough dude, and he was a little remember that's an intervention. Remember we're looking at it, we're focusing and directing, so we're looking at it under ultrasound the whole time. Mm-hmm. And yours, it was super cool because we could see exactly where we were putting the material. We could see what it was doing. And so what kind of downtime did you have? Now for him, it's a little different. He had I mean, he's a 15-year-old kid at this point with symptoms for 2 years. So we really slowed him down a little bit.
Yeah, for
And we
sure.
did that on purpose,
Yeah.
right? But what kind of downtime did you have after the procedure?
I mean, just I was in the brace for like 2 weeks, couldn't really like do too much physical activity, and obviously not bending it.
Right.
And so it was a little annoying, not really annoying, but it was just couldn't do as much until like the time period went away and you got to do a little bit more, but then of course the second injection. So I mean the down period wasn't too bad. It was just kind of had to deal with it.
Feels like forever when you're like,
Yeah.
for us, it's like not that long,
Right.
right? A month is not super long. For him, it takes forever. So when did I let you sort of start doing some jogging after the second injection? So after we've done our full series,
Yeah.
when did we start to get sort of back into more normal activity? How long was that?
I think it was like 2 weeks probably.
Yeah. So we were,
Came early December, and yeah, it was about 2 weeks. That it was some light movement, and just slowly progressed from there.
but no real downtime.
No.
Yeah.
Like we didn't have him on crutches. We didn't do any of that stuff.
Yeah, it was a great part of it. It's like, you think of surgeries and like you're out for like a whole season or stuff, and I got this done and I'm back to pretty much all the soccer, and like hardly any time to wait or anything.
Yeah, so what's life like now? Now we have to full activity. We released him, was about 4 weeks after his last procedure. We wanted to just kind of get him through the holiday season, and then he started back into what we call sports-specific exercise. And it's been a pretty rapid progression. What are we doing now?
I mean, I'm playing full games, working out, like in the weight room, running, a lot of running for sure. I'm not feeling any pain or any discomfort.
That's so great. It's just awesome. And again, it was 2 years of chronic pain, not
Exactly.
able to do any of that stuff.
Yeah.
Constant icing, heat,
Yeah. Every time I like go into a game, I'd know it's like gonna have to deal with it after. It'd be tough, but
Right. So what would you tell somebody who's thinking about coming to Pinnacle Integrative Orthopedics and using the Pinnacle method to really optimize both their health and their joint, and their joint pain? What do you think?
I mean, I fully recommend it. It was great for me personally. I didn't have a single like down part of any of it. It was a great experience, and it obviously helped me perfectly fine.
What do you think, Sarah?
For me, I've always been more of a natural, medicine kind of person. It far any other option that we had. It went quicker than I even expected. I mean, I knew it would work. Just my gut told me this is the right thing to do, but it was faster, especially at this age. With kids.
It's crazy, right? Like they heal so fast.
And I mean, but their bodies are made to heal.
Right.
And just to avoid lifelong
Yeah.
issues, I would be the only way, I would say. to
Thank
go.
you so much.
Absolutely.
Hey, let's do less surgery on our kids, right? Let's do less surgery in general. Let's these like innovative, modern, technologically advanced methods where we can get people healthy and get people to heal their joints without these major invasive surgeries or steroid injections or narcotics, right?
Let our bodies do what they were made to do. I mean,
Absolutely.
we were made to heal ourselves to a point, of course, but yes,
For sure.
absolutely.
Thank you so much for being a great patient, my friend.
Of course, I loved having you.
It's been such a pleasure.
Thank you.
Sarah, thank you
No,
for believing
thank
in the
you.
process.
Absolutely. I
Cool.
wouldn't do anything else.
Landon, everybody. Good stuff. All right, brother. Well done.
Thank you.
That was
All right.
great. So good. That's getting 1,000 hit. Like at least 1 million, right? Like that's going.
Got it.